For the descriptive purpose, the anterior abdominal wall is divided into some regions by some lines. Okay, there are some planes are there. So now we are going to see what are the planes of anterior abdominal wall. The first one is known as the transpyloric plane. Transpyloric plane. Let us see. Here we have the This is the transpyloric plane. Okay. So how will you draw the transpyloric plane on the surface of the body? Okay. First you make a line from the jugular notch. You know there is interclavicular. Here we have the two clavicle. Interclavicular, that is jugular notch. From the jugular notch to the pubic symphysis, if we make a line over here and and the midpoint of that particular line, okay, and that is known as a transpyloric plane. Transpyloric plane, remember these levels of transpyloric plane passes through the tip of the 9th costal cartilage and the lower border of the L1 vertebra. Lower border of L1, 9th costal cartilage, tip of 9th costal cartilage anteriorly, and posteriorly we have the lower border of L1 vertebra. Lower border of L1. Remember these two points. Then, and roughly we say it is a hand breadth below the subcostal joint. So here we have the subcostal joint. From here a hand breadth below the subcostal joint. And what are the importance of this transpyloric plane? Remember, pylorus of the stomach. At the transpyloric plane, what are the structures seen at this level? Okay, so we have first one is the pylorus of the stomach, hilus of the kidneys, fundus of gallbladder, origin of superior mesenteric artery, and lower end of spinal cord. So these are the structures present at the level of transpyloric plane. So once again, what is transpyloric plane? Transpyloric plane is a midpoint of a line joining the jugular notch to the pubic symphysis. Okay, anteriorly this line passes through the 9th costal cartilage, and posteriorly we have the lower border of the first lumbar vertebra. Okay, and roughly it is a hand breadth below the subcostal joint. What are the main structures? We have the pylorus of stomach. Remember, hilum of kidneys, fundus of gallbladder, origin of superior mesenteric artery, and lower end of spinal cord. Okay, and normally the transpyloric plane is used for examinations. Okay, because it has got some this importance. Remember this point. Next plane is the subcostal plane. Subcostal plane. You know, costal. You know the costal margin. Costa means ribs. Okay, so that means we have the costal margin. We have the right costal margin here. This is the thought process, and here we have the left costal margin. So the line passes below. This is known as the subcostal line. Subcostal. So here you can see the subcostal. So we have the two costal margin. Remember, the subcostal margin passes below the subcostal line passes below the costal margin. Remember, it passes through the lowest part of the 10th rib and the lower border of the L3. Okay, so the transpyloric plane was passing through the 9th costal cartilage, and this plane is passes through along the lower part of the 10th rib or along the 10th rib, and the vertebral level is this was L1 and this is L3. Remember this L3. And there is one more important plane that's called transtubercular plane. So transtubercular, you know the tuberosity of iliac crest here. Okay, so this plane passes through the tuberosity of tubercle of iliac crest. Okay, tubercle of iliac crest, and this is passes along the body of the fifth lumbar vertebra. So we have three transverse plane, that is the transpyloric plane, then we have subcostal, and the next one subcostal, and there is a transtubercular. Okay, easy to remember the vertebral level L1, L3 and L5. L1, L3 and L5. Remember this one. Okay, and there is a horizontal line, that is a mid-clavicular line. We have the mid-clavicular line passes through the, we have the clavicle here, middle of the clavicle to the mid-inguinal point. This is the mid-inguinal point. Mid-inguinal point. You know the mid-inguinal point. Okay, so middle of the clavicle to the mid-inguinal point. So that is known as the mid-clavicular line. Mid-clavicular line.